Hi, Attorney Bob Lightfoot with Reinhard Berner Van Duren here with my update for the week of July 20th, 2020. Hope everybody is staying safe. So I attended the Assisted Living Forum and the Nursing Home Forum this week. Not much to report on the Assisted Living Forum. There was a repeat of the Risk Management PowerPoint by Dr. Murphy a second time this week. There was really no additional information provided there. An issue did come up regarding the variances, and some folks feeling like the variances need to be extended because clinics aren't opening to be able to conduct communicable disease testing and the like. And what we found out through WALA was that Alfred is saying just go ahead and resubmit those variances and include in there the reason that you need to extend the variance. It could be the clinic's still not open, or any of a whole host of reasons. So be sure you put that in so that you can actually get those extended. The other issue that came up, really the last issue for assisted living, was staffing. Obviously there's still staffing issues, and the recommendations were if you could hire CNAs. They are exempt from some of the initial training, so you can get them much more quickly on the unit. And same with folks who have already had testing and can prove that, or I'm sorry, the training is what I mean, not testing. If you can show that they've had the training, especially the infection control training, then you can get those people up and running. I had thought by now testing would be available for assisted living. That's been lagging. We still are not seeing testing yet. In fact, there's been a hitch that's arisen with regard to staff testing in nursing homes. So stick around for my nursing home summary coming up here, because assisted living is going to find that very interesting. So the first thing, let's just get right into it, was the testing. Currently, staff testing in the nursing homes, which had formerly been required, is on hold. I believe it's because they are just not able to process all the tests. DHS did say they're contracting with some other labs to get the testing done and get those up and running so that the hold can be lifted and staff can start getting tested again. They did say that that's still a priority to get staff testing done, that they're still committed to it, but right now it's on hold. So, in terms of the testing, I think it's going to be a while before we see assisted living testing up and running. So that's not good news, but there are shortages of testing kits nationwide, just as there still continues to be PPE shortages. So, that's just the fact of life right now. The next issue of particular interest is return to work criteria for CDC under CDC guidance. And CDC is no longer recommending a test-based return to work strategy. They've simply given now revised return to work for a non-testing based strategy. So let's go through the revised guidance that was issued on the CDC website of July 17th. What I did was I simply Googled return to work criteria and CDC, and it popped right up for me. So there's three categories. The first is, and this is healthcare staff, by the way, healthcare staff return to work, obviously. So no more test-based strategy. The first criteria would be for those folks who had severe COVID disease and were critically ill with COVID, those staff. And so for those staff, you will exclude them for 20 days from the time of the onset of symptoms, or 20 days after the first test. And there has to be 24 hours from their last fever before they can return to work. And part of the reason for that was shared was that those folks tend to shed virus longer than folks who had mild illness or were asymptomatic. So let's move right into the next category, mild or moderate illness. There's a definition of that on the CDC website, and that's going to vary, but you can kind of gauge that for yourself, someone who is sick but not severely sick. So there you're going to want to do 10 days since symptoms first appeared and 24 hours since the last fever and that symptoms have improved. So that's the return to work criteria for healthcare workers who had mild to moderate illness. And then finally there is that category of asymptomatic, positive but asymptomatic. And so the criteria for return to work there is 10 days since the first positive test they can return to work. Now remember, return to work still means using PPE, and that means a face mask at all times instead of a cloth covering, and self-monitoring and reevaluating for symptoms. So that's very important and very crucial to what you need to know in terms of having staff return to work. I will say that the DHS website for Wisconsin is in desperate need of updating after providing this information. The information was provided, but the website is still not updated with this information. So what you should do is rely on the CDC guidance, not the DHS current guidance, because it's out of date. And then some other issues are there is a new PPD Optimization revision from CDC, and again, all I did was I Googled summary strategies to optimize PPE, and then I added CDC in there, and it popped right up. It's really not too much different, but there is some categorization now of PPE in terms of strategies that should already be in place, contingency capacity, and then crisis capacity. So I would urge you to look at that in order to look at what the latest recommendations for optimizing PPE are. In addition, FICS surveys continue. Salon Guidance, I know that was a big issue, and they're keeping that at its current state right now. They are looking at possibly revising it. I think the sticking point, as you know, for most of you is having one stylist for one facility. Or if you're a campus, you can use one stylist. But, that's the sticking point, and that's really not workable for standalone 20-bed, facilities. It just doesn't work. Or standalone nursing homes, unless you got a retired or part-time, someone that's willing to come in. But the reasoning there, they said, was because we're sort of at a high point in terms of our numbers of positive COVID in the state, and many counties and municipalities moving to mask requirements, public mask requirements. So that's the reasoning. The other thing I should mention on the FICS surveys that they want to point out is one area they're seeing a lot of non-compliance with is dietary masking and lack of dietary social distancing. They did recognize that social distancing in small dining, food prep kitchens and areas is difficult, but to try and do that to the best of your ability. So that's really it. I'm curious to know how your outdoor visitation for the nursing homes is going and how your visitation for assisted living is going with the new guidance. If you have any questions on that, as always, feel free to give me a call. I hope you all continue to stay safe, and hopefully we get through this sooner than later. Thank you.